All right, everybody, welcome. We'll just wait a couple of minutes for everybody else to kind of pop in. So go get yourself a cup of coffee and hang out for a few minutes, and we'll get started in just a minute. Good morning and welcome to our Understanding Medicare, the in and outs of Medicare coverage, or making Medicare manageable. My name is Kara Franstead, and I'm going to kick it over to Kim Herman, who's going to tell you a little bit about what we do and how she got started in this business. Go ahead, Kim.
Good morning, everyone. So I'm Kara said, I'm Kim Herman, and our company is KMH Financial Services, and we clear through LPL Financial. We have been in, I've been in this industry for 25 years, and before that I was in corporate finance for a number of years. Our big mantra is that we're here to hold your hand through the whole process. We do very extensive financial planning, and we also handle your investments. So we're a mother-daughter team. Here's the daughter. And I'll have her introduce herself right now and tell her a little bit about her background as well.
So I'm Kara Franstead, and I started out my career in the United States Navy, and I still really wanted to serve when I ended my time in the Navy. And Kim is my mother, and so we happen to have this conversation about many different ways to serve. And she was talking about how you can serve people in the capacity in finance. And I was sold. And so I joined the family business, as it were, and it's been 6 years now. And it was the best decision I ever made. We love doing what we do, and we've had a lot of fun. And now to give our presentation, Kim's going to tell you a little bit about Danny Cohen, and then we'll get started.
So we've been working with Danny for a number of years. Danny's a senior business consultant for John Hancock Investments. He consults all independent financial advisors in the Delaware, Maryland, and Northern Virginia area. And he's responsible for the John Hancock Mutual Fund, ETFs, and separately managed 529 plans and 401k investments. Danny consults financial advisors on branding and marketing their practices, and he's a certificate holder of the NSSA Social Security designation, which he gave for us last month. You can find it on our website. You can record it. And he's also a subject matter expert in this Medicare. He's been with John Hancock for 18 years and in the financial investment industry for 22 years. He's a graduate of Concordia University in Montreal, Canada, and has a BA in economics. He's been married for 24 years to his wife Stephanie, and he has 2 kids, his daughter Nikki, 14, and Trevor, 17. So with no further ado, we'd like to introduce Danny Cohen.
Thank you, Kim. Thank you, Kara. Welcome to everybody on the call today. To some of you on Social Security. I know Medicare is a difficult topic, as is Social Security. There's a lot of moving parts in both of them, but I think what I could do today is to give you a much better understanding of Medicare. There's a lot to cover here, so you may want to take some notes. The good news is, after the fact, a lot of the slides have notes under them, and there's a great Q&A guide that Kim and Kara could get to you after the meeting, just in case you miss some of the things that I'm saying. So you'll hear my little New York accent. As you heard Kim mention, I'm from Montreal, which is like another planet for people here in the Atlantic. I think I was the only one watching the Montreal Canadiens hockey game versus Vegas 2 nights ago here in the Mid-Atlantic. But listen, thank you again for joining. All right, so let's talk about Medicare. So typically what happens just before your 65th birthday is you're going to get inundated with mail, with calls, with people trying to sell you some kind of healthcare insurance plan. And the documents are going to come to your house, and you're going to look very much like this couple here. You're going to stare at them and have this confusing look on your face, which is going to really beg that question: is this how understanding Medicare makes you feel? As I said, it is confusing, but there isn't really one place to go that really explains it to you very simplistically. And I think today I might be able to help do that. So our agenda topics will be the history of Medicare, Medicare parts and when to enroll, Medicare costs, Medigap plans, Medicare Advantage plans, and then of course, if you're working past 65, some things you need to know around Medicare. So history of Medicare. Many people don't necessarily know when Medicare started. So it was signed into law in July of 1965 here by President Lyndon Johnson. And keep in mind at that time, prior to Medicare being signed into law, there really was no good national health care plan for people for when they retired. And what happened is you had a lot of seniors, especially people over 65, over 50% of them did not have in-hospital coverage, which caused over 8 million seniors to be living in poverty in 1965. And you'll see here, President Truman and his wife were the first recipients of Medicare Card 1 and 2. And you ask why, and that's because when President Truman was in office, he was a huge proponent of a national health care program, especially Medicare, even though many of his proposals were defeated when he was in office. When Medicare was finally signed into law when President Lyndon Johnson got in, they felt it only appropriate that President Truman and his wife be a part of it, since he was a huge reason as to why Medicare was signed. So when it went into effect, 19 million people initially enrolled, and today, over 61 million people are enrolled in Medicare today. About 40% of them are on Medicare Advantage plans. And they say by 2029, it'll account for about 18% of the federal budget. So definitely a huge day for everyone. When you talk about Medicare, it's really all about the parts, and this is where it gets confusing for people. So there's 4 parts to it. There's Part A, there's Part B, Part C, and D. When you look at Part A, that is what you know is your hospital coverage. When you go into the hospital, this is where Part A pays for it, assuming that you're paid up for the course of your lifetime. And usually for most people, Part A is free if they've worked and have the necessary hours, and you're paying this into your FICA taxes over the course of your life. So when you hit 65, for most people, Part A premium is free, and this is what you know is your room and board. Part B is where everybody has the questions about whether I should take it or not. This is your outpatient coverage, and this is your doctor visits, your lab work, preventative care, outpatient surgeries, physical therapy. What's important here is to know is Part B covers 100% of preventative care and 80% of all other outpatient care. So as an example, a COVID vaccine or a flu shot would be an example of something that's considered preventative, so it actually would be covered at 100%. Or let's say you needed a mammogram or a colonoscopy or a bone mass measurement or a diabetic screening. These are all considered preventative care things, so Medicare covers that at 100%. Things like knee replacement or cataract surgery, those are considered outpatient surgeries. So Medicare pays 80% of that bill, and then you pay 20% of that bill. So a lot of people get concerned if they get cancer or they have kidney dialysis because you're on the hook for the 20%, but I'll talk a little more about that here in a minute. You'll notice as you look at the picture here on the bottom, you see this man smiling in the doctor's office, and I keep saying to people, the only reason why he's smiling is because he hasn't seen the bill yet. So these two make up what you know as original Medicare, Part A and Part B. And original Medicare was really modeled after the Blue Cross Blue Shield plans in the early 60s. Those plans had an in-hospital coverage component and an outpatient part, and that's how Medicare was modeled after those plans. Those are the only two you get from the federal government. And Part C came after. Part C is confusing for people because it's not necessary to get it. If you don't get it, it doesn't mean that you incur a penalty. And I like to think as Part C as the travel agency. It's where you can get Part A, Part B, and Part D all in one, Part D being the drug program. And just think of a travel agency. It's like saying, okay, I'll get the flight, the car, and the hotel all from the travel agency, and that's really what Part C is. It came out in 1997. They rolled out this Medicare Advantage plan program, It was signed into law by President Clinton at the time, and obviously these are the ones you see advertised on TV a lot. Part D is what you know as this voluntary drug program, and this was groundbreaking. This came out in 2006. It was signed into law by President Bush. It's what you know as your pharmacy card, and it pays for a lot of this outpatient Part B drug coverage. So for instance, if you had cancer and you need a lot of those drugs, that's where this Part D comes in. It's where in the initial enrollment period or in the fall enrollment period between October 15th and December 7th, where you can get into these plans and out of these plans, but very important. People ask, okay, so how do I enroll in Medicare Part A and Part B? And you do that through the Social Security website, and it takes about 15 minutes to do it. You will know that when you enroll in Part A and B, you do it through Social Security. If you work through one of the railway companies, you do it through the Railroad Retirement Board. And if you're already receiving Social Security benefits, let's say at 65, you're automatically enrolled in Medicare. If you're not receiving benefits, you'll get a bill to be billed quarterly if you're enrolling at that time, and you can set up an easy pay account on Medicare website where you could pay that monthly. What's most important about a Medicare is the initial enrollment period. You hear everybody talk about this 7-month window when you hit 65. So how it works, it begins 3 months before your birthday month.
Danny, we lost you for a second there.
Includes your birthday. Oh, can you hear me again?
Yeah, you froze for a second there.
Can you hear me?
Yep, got you now.
Okay, it says my internet connection is unstable. All right, just in case we go out, I will dial back in and then kind of try to do it that way if you have the presentation. So we should be good. So I was talking about the initial enrollment period. So just to review that, it's 3 months before your birthday month, and then it includes your birthday month, and then 3 months after your birthday month. So that's the 7 months. An example of that would be, let's say you turn 65 on May 20th. Your initial enrollment period for Medicare would be February 1st to August 31st. So they're going back 3 months from May 1st. It starts from the first of the month of your birthday month and then goes back. And then, of course, 3 months after. So people say, okay, well, when does Medicare start? And it really depends on when you enroll. If you enroll in before your birthday month, which we said was May 1st, you have February, March, and April to enroll, and then you would start May 1st here, as you see, of the birthday month. And then the exception is when you're born on the first of the month. So let's say your birthday is May 1st. You actually would start April 1st, and then your period to enroll would be actually a month earlier. So it would be January, February, and March, those 3 months prior to the April 1st month as to be your enrollment month. So you would go live on April 1st if you were born May 1st. No, that sounds confusing, but that hits about 7% of the people, not only on Medicare, but obviously on Social Security benefits as well. It works the same way. If you enroll after your birthday month, let's say in the month of your birthday, it'll be delayed by a month. If you enroll, let's say in June, because your birthday's in May, it'll be delayed by 2 months, and so on. If you miss this period of initial enrollment period for Medicare, there is this general enrollment period from January 1st to March 31st. The only bad part about that is even though you enrolled at the first quarter, you're not actually going to be live in Medicare until July 1st. So let's talk about the cost sharing of Medicare. So just to kind of give you a sense, I work for a big company like John Hancock, and I pay into a health insurance plan. Every 2 weeks, I get the premium deducted from my paycheck, and that's probably similar to what most of you have. And this is the cost of the insurance, is what we call that monthly premium. But when I use the medical services, I have to pay the deductible, the co-pays, and the co-insurance, and that's what we refer to as cost sharing. And when you look at some of those costs, just to kind of give you a sense of what's eligible here, you know, remember I said Part A for most people is free on the premiums, but not in the cost sharing. So just so you understand what's going on here and what makes you eligible. It's a lot of writing here. I'll ad lib to some of this stuff so you get a better sense and an example. But Part A costs nothing if you've worked and paid into FICA taxes for at least 40 quarters, 10 years. So that's the same as Social Security. So people ask, what if I work 9 years, 6 months? Can I go back to work and get the 2 extra credits I need to be eligible for the 10 years? And the answer is yes. People do it all the time, not just to get Medicare benefits, to make sure they're eligible for their Social Security benefits as well. You'll see you're considered paid up for Part A premium, obviously, if you've paid in, so that would cost you $0. But there are people who, let's say, don't have enough quarters to work where they're eligible. So people ask, well, what if I had 30 to 39 quarters? How much would Part A cost me? You'd have to pay $259 this year in 2021 to get Part A. If you had less than 30 quarters, it would cost you $471 for Part A. And if you don't have it, you would be paying a penalty there, possibly. So that's why it's so important. You would qualify under your own work history or a spouse. A lot of teachers have this if they haven't paid in. And of course, you have to have been married a year, and the spouse must be eligible for Social Security. So this is important. Let's say you're 65, you want to file for Medicare, but you want to do it off your spouse's work record, who's now 61. Well, you're not going to be able to file for Medicare at 65 for Part A, because you need to wait for your 61-year-old spouse to be 62 and thereby be eligible for Social Security. So you would have to buy Part A for a year until you turn 66, and your spouse would be 62 and eligible. A lot of people don't know that, but it does come up from time to time. In the case of divorce situation, it works just like Social Security. You have to have been married 10 years, and you must be single in order to be on that Medicare. And then in a widower situation, survivor benefit, you must have been married 9 years before the spouse died. And if you're single, you can qualify. If you marry after 60, you can qualify off that first spouse for Medicare and for Social Security. It works the same way. So Part B and Part D, the costs are different than A, especially on the premiums, because I said for most people, Part A is free, but Part B and D are not. And this is what people don't really understand that well about Medicare. So you pay monthly premiums. The base premium on Part B is $148.50 in 2021. That amount would be deducted monthly from your Social Security check, assuming that you were already receiving Social Security. And if not, I mentioned you'd be billed quarterly from Social Security, and you can set up a monthly Easy Pay account on the Medicare website. What I think most people want to know is the discussion around the IRMA for higher earners. So in 2007, nobody was happy about this, but Medicare and Social Security basically decided they were now going to give people an IRMA, which stands for Income-Related Monthly Adjustment Amount for higher earners. So if you earn more than $88,000 or $176 jointly, you now have this sliding scale on Part B and D premiums, and it's based off your modified adjusted gross income on your tax returns. So how this works is Medicare and Social Security take a 2-year look back. So let's just say that you wanted to file for Part B premium here this year in 2021. They're going to look at your 2019 tax return and look at that modified adjusted gross income. So you could be 63, you're not realizing, you're saying, okay, I'm going to file for Medicare at 65, but at 63 now, you sold an investment property, you had a big capital gain there, or you took some dividends or some things out of your IRA and you had a taxable distribution. Maybe you inherited some money and you took a distribution from that IRA. That could knock you up into a different tax bracket. So just as an example, if you hit the 176 here between 222, you wouldn't be paying 148 anymore, which is the base premium. You'd now be paying $207.90. So if you have a big cap gain, each you and the spouse could be paying as much as $475 a month per person for this Medicare Part B premium. So a lot of people don't realize this, and you could be 68, still working, you delayed Part B and not realizing you did a Roth conversion or you sold an investment property, and now all of a sudden when you retire at 70, they look back to 68 and you have a big tax situation and you have a big premium to pay. People do appeal this. There is a form, it's called SS-44. It is on the Social Security website, SSS-44. It's in the notes you would see it. And of course, Kim and Kara can help you with that. But you can appeal. What Social Security is looking for is a work stoppage. So if you retired or you were divorced or you had a death in the family and that changed your income, you're more than likely to win the appeal. If you had an addition of income, like the sale of a property, there's more than likely that you're not going to win that appeal. But you can appeal as many times as you want. Sometimes you don't need to appeal when you hit 65 or when you first retire, let's say at 68. You may need to do it, let's say at 72, because that's when you sold your property or you inherited some money and had to take a taxable distribution. But Medicare looks at that, and Social Security every December, they want to see your tax return. The IRS typically sends it to them. So then in January, they send you a letter letting you know what the IRMA is. Part D premium, how this works is you get Part D from a private insurance company, and it ranges cost-wise from $7 a month to over $205 a month. The average plan costs $40 a month, but the premium is still subject to that IRMA, and I'll show you that here in a second. But if you don't file for Part D and you don't have credible drug coverage at the company you're working at, you will pay a penalty of 1% a month. So if you don't get the Part D drug program for 5 years and then you decide to get it and didn't realize that you didn't have credible coverage, you're going to pay a 60% penalty, and that's for life, because that's on 5 years. The scale here, you'll see how it works. The income's the same. They do a 2-year look back similar to Part B. The premium that you pay is different. But then again, if you win the appeal on Part B, you automatically win the appeal on Part D, and vice versa. If you lose the appeal, same story with the Part D. You don't get the break there either. So now that we talked about Part A, Part B, and Part D premiums, let's talk about the Part A cost sharing. And this is what people really don't know about Medicare. This is the big mystery. And what people don't realize is, yes, Part A could be free for you because you paid into FICA tax throughout your life. But once you start using the benefits, if you go into the hospital, because they said Part A is your in-hospital coverage, you're going to pay a deductible of $1,484 right out of the gate. And you'll see there's some co-pays here. Between day 90 and 150, you have reserve days. That's once in your lifetime, those 60 days. And then you'll see here at the bottom, $185 a day co-insurance for skilled nursing beyond 21 to 100 and skilled nursing days. So Medicare pays for the first 20 days, but you may be wondering, okay, what happens if I got to go into a long-term care, nursing facility, or I need home health care long-term? Well, this is a reason why probably Kara and Kim have already talked to you about long-term care, or might be talking to you about it in the future. It is mutually exclusive from Medicare. So you may be on Medicare, but you still need long-term care. How this works to understand the deductible, it's done on a 60-day time frame. So let's say you go into the hospital on May 1st, you come out 30 days later on June 1st, and then you go back in on June 15th on a 45-day cycle. The good news is you don't have to pay that $1,484 deductible again. You're already within that 60-day period, and it continues on with what you see here. If it's beyond that, then you have to pay it twice. Example, May 1st, you go in, you come out June 1st, 30 days later, and now you go back into the hospital in the middle of October. Well, you're going to have to pay again that $1,484, and this benefit period starts all over again. And that's something that people don't know, and that actually does become very scary for people. So Part B works differently as far as the cost sharing. You have to pay the Part B deductible $203 a month. Each spouse has to pay that if you file for Medicare, right? Each of you pays that. And then Medicare pays 80% of the bill, and you pay 20% co-insurance. So where this gets scary for people is if you get cancer or you have kidney failure and you need dialysis, there's no cap on that Part B. You pay 20% forever. So to have to pay a hefty bill on chemotherapy and dialysis could put you into bankruptcy, which really does scare people, which is the reason why we're going to talk next about how people cover those gaps. And there's two ways to do it. And you get them both through the private insurance market. So the first part is what you know as Medicare supplement plans, also known as Medigap plans. If you hear either term, supplement or Medigap, it means the same thing. And this is the Cadillac service of healthcare for what you want to do when you retire. So you get original Medicare, you get Medigap, and then you'll add a standalone Part D drug program, which I'll show you here in a second. But yes, there is some higher premiums, but there's really no cost sharing here. You almost don't really have to pay anything out of pocket because the Medigap plan picks up the 20%. Medicare Advantage plan is what you see mostly advertised on TV by Joe Namath. Usually in the fall, your favorite program or your football game is interrupted by you're inundated by these plans telling you zero premiums or lower premiums and higher cost sharing. So these are the two ways people cover the gaps. Medicare Advantage is a little bit more cost effective for people in retirement. And when you look at Medigap, what you want to know is the Medigap company pays after Medicare. So Medicare is still primary. You still need to file for Part A and Part B premiums there. You have to pay them. Medicare pays 80% of the bill, and then Medigap covers the remaining 20% of deductibles, co-pays, and co-insurance. People love the fact there's no referrals necessary. You can pretty much see any participating provider across the country, assuming they take Medicare. 93% of the doctors in the country accept Medicare. Thereby, the Medigap company will pay the bill because Medicare accepts the rates. So Medigap plans are great for travel. If you're a snowbird, they travel well because you can see pretty much any provider in the country. And of course, many different insurance companies offer these plans, and they're standardized so they don't change. And you'll see this here. The benefits don't change, the prices do in Medigap plans. And the most popular one up until January 2020 was Plan F. And for anybody who turned 65 prior to January 1st, 2020, they're grandfathered in even if you retire later on. And you'll notice when you look at the coverage here, Plan F covers 100% of these Part A co-insurance and hospital costs and the deductible. So everything I showed you on Part A, once you're in the hospital, is pretty much covered. They even give you extra 365 days of Medicare in-hospital stay, which people like. And you'll see as you look down F, even the Part B deductible is paid for. And that's part of the reason why you don't see this plan anymore. It's not available to people, past 65 after 2020. The reason is Congress got together and realized they didn't want every doctor or every person going to the doctor for every sniffle and cough. So going forward, they wanted to make people pay for Part B deductibles. So the most popular plans now are Plan G and Plan N. Plan G has everything that Plan F has. The only thing it doesn't pay for is really the Part B deductible here, which I told you was $203 per person. People like these Medigap plans specifically because you'll see at the bottom here, it pays for some foreign travel. So typically what will happen is the Medigap plan will give you up to $50,000 of coverage in foreign travel, and they pay 80% and you pay 20%. But Medicare pays for anywhere in the United States if you need Medicare services, assuming that the doctor takes it, which 93% do. But Medicare does not travel foreign where they'll pay. There's only really 3 instances where they'll do it. If you're on a cruise to Alaska and you're going through Canada, or you live on the border of a Mexican or Canadian hospital, or you're within 6 hours of shore on a cruise, then Medicare will pay the bill. But beyond that, that's where Medigap can really help you out, or you buy, travel insurance. A lot of people do it when they go to Florida. Plan N is a little bit cheaper than G. It pretty much covers most of what F and G do cover, but you'll see no paying for the deductible of Part B and not paying for the excess charges. So what that means is certain doctors can upcharge you 15% if they don't accept Medicare's assigned rates. So you'd go to the doctor in Plan N and you'd have to pay a $20 copay, $50 ER visit, and then you'd be on the hook for the 15% excess charges from the doctor. So more affordable way, but that kind of gives you a sense of how this all works. And then when you look at the monthly premiums, each Medigap company sets their own rates. Insurance brokers, Medicare brokers cannot change them, so it really doesn't matter if you buy it from one insurance agent or another. It's the same as what you're going to pay if you go directly to a Blue Cross Blue Shield or Aetna, or if you buy it from a Medicare broker. It's all going to be pretty much the same rates based on what? Age, zip code, gender, tobacco use. Remember I said that each of you has to pay that Medigap plan. If you're husband and wife or a spouse situation, you're each going to have to pay. So there is a family discount. It's not much. It's cheaper in Oklahoma and Iowa, but it's more expensive in Florida, and I'm sure you're not surprised about that because Florida has so many retirees. So when you put it together and you want to understand what this is going to cost, if you look at Medicare, you have Part A and Part B. You must file for those two in order to get into a separate Medigap plan. And then you're going to add a standalone Part D drug program because that's not built into these two things. Part A, you'll see for most people is free. The base premium $148.50, and then you take the average of the drug plan cost, which is $40, I said earlier. And then a Medigap plan for Plan G in Texas is $120. Here in Virginia and Maryland, you're looking at somewhere between $105 and $140 kind of thing. So if you just figure about $320 a month for each of you, you're looking at about $640 for very, very good coverage, and you pretty much wouldn't have to pay anything in co-insurance here. Some people where it's, each of you, maybe one of you works at a company and the other one's on that person's big employer insurance. Some people, when they reach 65, will leave that big employer insurance because they can get on Medicare and a Medigap, and it will be cheaper. So typically when you're the spouse on the insurance plan, you all know that it becomes more expensive. Whereas if you're the actual employee, it's cheaper. So that's what I meant about somebody leaving the plan. The spouse would leave and maybe go on Medicare. The big thing for Medigap is the open enrollment period. And that's that one-time window. And it's 6 months after Part B is effective where there's no health questions, no underwriting. So if you have a chronic illness at 64 and now you hit 65, the Medigap company has to take you because in the first 6 months, there's no health questions. So people with cancer or are diabetic, this is a huge thing. You get in right away, no health questions asked. Guaranteed issue period. So let's say you work for a small company at 65, you filed for Part A and Part B because Medicare is primary and they pay 80% of the bill. When you retire, let's say at 68, you're going to get a 63-day window there when Part B is, obviously already effective, where you lose coverage when you retire. You can get into a Medigap plan with no health questions for 63 days. Medical underwriting. If you miss these periods and you don't work for a big company and you don't get that 6 month after you retire, they look at a 2 to 5 year medical history. You go through underwriting. And sometimes people ask, well, what if you had cancer? Will they accept you? They're usually looking for a 2-year window where you're cancer free. If you're diabetic and you're taking the pills, there's a good chance they'll accept you. So the rules for underwriting are different in certain states. In New York, it's open enrollment, no underwriting questions every day, but you pay a lot higher for the plan. In California, once a year on your birthday, you have no underwriting questions where you can get into a Medigap plan. So big misstep that people confuse is they misconstrue the Medigap open enrollment period and the annual election period. So as a reminder, I said Medigap open enrollment is when Part B goes effective, even if you retire at 68, you then get this 6 month open enrollment period, assuming if you're working for a big company, that's typically what you see. But mostly during that open enrollment period, the initial one, that's what they're talking about here. And then the annual election is when you can get in and out of a Part D program if you miss the initial open enrollment, and when you can get into a Medicare Advantage plan. And those dates are October 15th and December 7th. These are usually if you miss your windows after you retire or when you first hit 65 and you need to get Part A and Part B. So that's why you see so many advertisements on TV in the fall. You may ask, well, why can't I get into a Medigap plan if I am sick? It's no different, after the fact with your homeowner's insurance. If your house is on fire, the insurance company is not going to insure you. It's the same thing with Medigap plans. That's why you go through underwriting. So in summary on Medigap, you want to ask the doctor before you go, do you accept Medicare? I said 93% of the doctors accept it, and that's important because if Medicare doesn't pay the bill, guess what? Your Medigap company will not pay that remaining 20%. They coordinate with each other, so Medicare sends the bill to Medigap, and then your Medigap insurance company pays the rest. And you'll see the plans are standardized, so the benefits don't change, the prices do. And even if you get sick while you're on a Medigap plan, they still have to renew you. And then, of course, you would add a standalone Part D drug program. So standalone Part D drug program, in this case, you would get original Medicare, A and B. You would then get that Medigap plan separately. And then during your initial enrollment period or in that fall enrollment period, you would add this standalone drug program. You need to be either enrolled in Part A or Part B to get Part D, and you must live in the plan service area. So if you move, you'll get this special enrollment window to switch out of a Part D drug program into another one. All right, so how does Part D work? There's 4 stages. What's most important is the deductible right off the bat. People ask, what is it? Medicare set it at $445 for 2021. The insurance company can lower it, but they can't raise it beyond $445. Most people, when they go to the pharmacy in January, they wonder, why do I pay more right off the bat when I have, medical coverage on my drugs? The reason is the deductible. So when you look at the coverage, what you pay will depend on which stage of the drug program you're in. There's 5 of them, and what tiers. So it depends on the drug as well. If it's a generic, you'll pay less. If it's a specialty drug, you'll pay the most expensive or a preferred brand kind of thing. And how this works after you pay the deductible is you go into this initial coverage stage where you pay the copay and co-insurance up to $41.30. And then everything after $41.30 between $65.50 is what people call the donut hole, the coverage gap. You'll see it's 25% of that amount between $41.30 and $65.50. The good news is, as of 2011, Obamacare, the Affordable Care Act, changed this from 100% down to 25%. So people used to get scared when you mentioned the donut hole in Medicare coverage because you'd be paying 100% of that $41.30 to $65.50. The good news is it's now 25%. Everything after $65.50, you go into catastrophic phase and you pay 5% co-insurance and some of what you see here. If you're trying to get a Part D drug program, you go on mymedicare.gov. There's a portal there where you can compare Part D drug programs. If you're already in one, you can get out of it. And when you automatically enroll in a new Part D drug program, you're automatically disenrolled in the one that you're on, and you don't even need to call them. All right, I know I gave you a lot. Your head's probably spinning off your head. The good news is that this guide that we'll send you after the fact will go through a lot of this in a little more detail and explain some of the things I'm talking about. But let's talk about Medicare Advantage. So a lot of people have these plans. About 40%, I say, are in them on Medicare. They're very affordable for people. These you get through a private insurance company, but it typically limits you to a local network. 90% of the plans have Part D drug coverage, so you don't need to get a standalone. But you're not getting out of paying the premiums for Part A and Part B, especially if you enroll. What's happening here is instead of getting your Medicare benefits from Medicare, you're actually getting your health benefits now through a private insurance company like Aetna or Humana. And what Medicare is doing is they're paying the insurance company, let's say $10,000 a year, to administer your health care benefits. And what are insurance companies in business to do? Make money. So they're trying to manage your health care, which is why you see the plan separate into 2 parts. You have an HMO version and a PPO. We have this at John Hancock. We have either choice. HMO, some of you are probably familiar. You need a primary care physician, and you will need referrals to go see a specialist, and you can't go see out-of-network doctors. So this is terrible for people who travel, especially for snowbirds. The good news is you can get in with no health questions, either through that initial enrollment period or after the fact when you retire. And most people don't like this because you have those prior authorizations, and in some cases can be a hassle. But if you're local, and you don't travel much, it's a much more affordable way to get your benefits. PPO, you can go outside the network, assuming the doctor pays the bill. You might have a little more cost sharing there. But what sells Medicare Advantage, one of them is routine dental, vision, and hearing. I know this is going to sound really crazy, but Medicare and Medigap plans do not pay for routine dental, vision, and hearing. I don't know who didn't think you needed your teeth or your ear, your hearing, or your vision, but the point is it was never built into Medicare. So a lot of people like to do this. You can buy a separate plan if you don't have it. And then most of these plans, you know, have a zero premium or a lower premium, but you pay a lot more in copays than you would in Medigap. So when you put it together, here's what Medicare Advantage would look like cost-wise. You pay $20 doctor visit, $50 specialist, $200 a night for a hospital stay, ambulance $300. I say take an Uber unless you're dying, because it's going to be a lot cheaper. But the issue of having cancer or kidney failure and paying chemotherapy and dialysis, you're still going to be on the hook for that 20%, but there is an out-of-pocket maximum, and you'll see it here, $75.50 at the bottom right here. And this is what really sells Medicare Advantage plans. People do not want to be on the hook forever on an unlimited amount on cancer, chemotherapy, or dialysis. So after $75.50, the insurance company pays the rest. You'll see 60% of the plans have a zero premium, but you still have to pay that cost sharing, which begs that question, are Medicare Advantage plans bad? Not necessarily. And that's just realizing if you get a major illness, you could be on the hook for 20% up to that out-of-pocket max. Or if you need an you need an MRI or a CT scan, you're going to have to pay for a good portion of that. So tips for Medicare Advantage. Build in a rainy day fund for unexpected costs. A lot of people have health savings accounts, HSA accounts. Just know that when you turn 65 and you file for Medicare, if you do, you can no longer contribute to an HSA account. You can take the benefits if they're qualified medical expenses and not have to incur a penalty or have to pay income tax. But to the point, you want to make sure that even if you're retiring past 65 and you're 68, if you're 68 and then filing for Medicare, you have to stop contributing to an HSA 6 months prior. The reason is IRS has a rule because Medicare and Medicare and Social Security retroact back 6 months of benefits. You're not allowed to contribute to that HSA if you're, let's say, turning 68 and filing for Medicare. You have to stop 6 months before, otherwise you incur a penalty. I said how and when you enroll matters, initial enrollment period or during that fall annual election period. And of course, don't forget to evaluate the plan. Why? Because in Medicare Advantage plans, not only do the prices change, the benefits change every year. Remember, Medigap, I said Medigap plans, the benefits don't change, only the prices. In Medicare Advantage, both of them change. And every September, you'll see this annual notice of change letter come to your house. Check it, because if you go see a doctor in January and you don't, your doctor may not be on there, or your drug formulary is important on that letter, because you may go into a pharmacy in January and you were on a medication in November and December, and all of a sudden it's not covered. And we all know there's nothing worse than standing at the window at a pharmacy when there are 10 people deep, and now all of a sudden they tell you you're not going to pay for your medication. So you can roll back out of Medicare Advantage if there's a problem between January 1st and March 31st. If you're already in a Medicare Advantage plan, you can switch back out into another Medicare Advantage plan in that general enrollment Medicare Advantage period. If you're on a Medigap plan, to try to later return to it, very difficult unless you're going back into the same Medigap plan that you're already in. Otherwise, you're going to go through underwriting questions. Misstep number 3, I mentioned not knowing the difference between Medicare Advantage and Medigap. I talked about that. Working past 65, very important. If you work for a large employer, more than 20 people, the group coverage of the company is now considered primary. They will pay 80% of the bill. Medicare is considered secondary, so they'll pay 20% of the bill. In this case, you can delay Part A and B and D. Now remember, for most people, Part A is free. So most people file for Part A at 65, assuming there's no HSA contribution. And then what happens is they delay Part B and Part D because there's credible coverage from the large employer. A lot of people ask, especially financial advisors, they'll ask, well, I'm 68, I filed for Part A at 65. I now want to retire. What do I need to do? There's a couple of forms that you need. One of them is actually going to be a signature from your former employer proving that you've had credible Part B coverage and D coverage, so that way you don't incur a penalty. In the case of a small employer, Medicare is considered primary, so you must file for Part A and Part B at 65 if you're less than 20 employees. Medicare pays 80% of the bill in that case, and the group coverage pays 20%. If you miss it, you could incur a penalty, especially on Part B, and that penalty is 10% a year. So if you didn't file and it's 2 years later, you're going to pay a 20% penalty for life. So you want to make sure that you file at 65 for Part A and Part B. Sometimes what people do is they call a friend, they ask the friend, do I need to file for Part B? Not realizing that that person works for a big company, and now they don't file. And then only later do they come to find out they have a penalty because they didn't realize the person giving the advice didn't need to file because they work for a large employer. So you want to pay attention to that. A lot of questions around FEHB options, federal employee health benefits. We always get that question here in the DC area. So here are your choices. You can enroll in Part A, because for most people it's free, be on FEHB, but because FEHB is not considered credible coverage for Part B, you will incur a penalty if you decide later you want Part B in a lot of those outpatient services. You can enroll in Part A and Part B and have FEHB. You'll have low to no copays. What I tell everybody here as to whether or not they should get B is what you should do is call the insurance company you use through FEHB, and that might be one of the Medicare Advantage plans, like let's say Blue Cross Blue Shield. Call them and ask them, hey, what happens? How much do I have to pay if I get cancer or need dialysis because I have kidney failure? How much am I going to have to pay? If it's going to be 20%, you want to make sure that you're getting Part B, and that's a good way to make the decision. Even if you're not sick, it just lets you know that if you get a chronic illness that you'll be covered. Point number 3, you can suspend FEHB, go right into a Medicare Advantage plan, and you'll get everything you need. You don't want to cancel FEHB because then you can't get back in later. And then when you have FEHB, you don't need to get a standalone drug plan Part D because that coverage is considered credible. All right, misstep number 3, enrolling too late. You heard my conversation about small employer, and you'll see here retiree coverage. A lot of people have retiree coverage. Let's say, I believe Verizon has retiree coverage. When you retire, you still need to file for Part A and Part B because in that case, Medicare is primary. Anytime it's primary, you need Part A and Part B. Obamacare, very simply put, these are for people under 65, affordable way for people to get health insurance. But keep in mind, once you turn 65, it's not considered credible coverage, so you need to enroll in Medicare. Otherwise, you are also going to lose your tax credit before 65 if you have one and incur a penalty possibly. So we're almost at the end. Let's talk about the review of this. So I talked about parts of Medicare. You get Part A and B through Social Security or the Railroad Retirement Board, and those are the only 2 parts that come from the federal government. Or you go through the private plan insurance market to get Part C or D. And Part C, I told you, Medicare Advantage plan, which is that travel agency analogy where I want the hotel, the car, and the flight all from one, or you can buy it a la carte. And then the routes. Ideally, what you want is to get original Medicare Part A and B, get a standalone Medigap plan, so you'll have the greatest coverage, and then Part D, standalone Part D drug program. You'll have higher premiums, yes, but just about no costs out of pocket, no doctor networks. Or you can go original Medicare, you pay for both A and B, get Medicare Advantage, and now you have a lower premium, maybe no premium, more cost sharing, limited doctors. What you really don't want, and this is taking chance, is that I go in with original Medicare, I don't get anything to cover the gaps, and now that I have that unlimited 20% spending on the Part B part, even though my Part A might be free. The working past 65, I said greater than 20 employees, you can delay Medicare, no penalty for delaying. And then less than 20, you must get Part A and Part B and Part D. Most people still get Part D through credible coverage of a small employer. And if you don't get these, you incur a penalty, as you know. So the last slide here is just some things to know as far as next steps. So Centers of Medicare and Medicaid. I didn't talk about Medicaid. Medicaid is for lower income individuals where maybe you can't afford to pay the premium or the co-insurance. Medicaid will help. They may even coordinate with Medicare to pay some of those benefits. Social Security website, that's where you file for Medicare. It takes about 15 minutes to file. Even if you're only filing for Part A, it's pretty quick. And you get a lot of the forms I was talking about on that website. Medicare, always recommend working through a Medicare broker. Most financial advisors do not sell Medicare. And I think if you always want to look at that, hey, I want Four Seasons, a Ritz-Carlton type of treatment, or Medicare broker can really help you with that. I recommend typically a company called Boomer Benefits out of Texas. They're a national Medicare broker. They have a lot of great YouTube videos. And I have not found anybody nationally who knows more about Medicare. They wrote our presentation. We paid them obviously to do it. They don't pay us for referrals. You may want to go through Kim and Kara. Maybe they have somebody locally that they may want to use, but I highly recommend a Medicare broker because if you have a problem with the bill, they'll help. And then under 65, you go to the healthcare market exchange. This is where you get those Obamacare plans under 65, just to kind of give you a sense. So that's it. No, it was a lot. Thank you for being attentive. I know there's a lot of good notes in the slides and a great Q&A guide that I know Kara and Kim will send after. But let me turn it over to Kara. I think we'll take some questions at this point, and I'll thank you again for being so attentive.
Okay, we have a couple of minutes, and I've gotten a couple of questions.
Sure.
So if you have any questions, go ahead and drop them to me, but I'll start reading the ones that I've gotten already. The first is the open enrollment period when you retire or when you hit 65? I'm a little confused.
Yeah, it's a good question. It always gets a little confusing. So when you hit 65, once Part B goes effective from Medicare, you filed for Medicare, it went on, let's say, effective on the 1st of your birthday month, May 1st in my example at 65, you get that open enrollment window for Medigap as well, that first 6 months from 65 when you're enrolled, or right after you initially become enrolled in Part B. When you retire at 68, let's say, okay, you have 8 months to get Part B when you retire. Once Part B goes effective, you'll get another Medigap open enrollment window for 6 months at that point, where you have no Medicare medical underwriting questions. If you work for a small company, you already have A and B at 65, remember, so then you only get a 63-day window from when you retire to get into a Medigap plan with no underwriting questions. The fall annual election period is totally separate. That's for Part D and Medicare Advantage plans. It has nothing to do with Medigap.
Okay.
I will tell you that took me about a month to figure that out. And that's where it gets a little confusing. There's some things in the notes and in the guide to explain that better. But that's probably one of the more difficult things for people as far as understanding that.
Okay. The next question I got is, would it be easier just to get the same Medigap as my husband?
That's a good question. In most cases, I probably would say yes, but you may be a smoker and your husband may not. And it'll depend on the rates in that situation, right? Tobacco use, age, and gender will depend on the rates. You might have two different Medigap plans. People do. One might be with, let's say, Aetna. The other one could be with United Healthcare. It just depends on what your particular situation is. You could get a discount there, as I said, but I'm not so sure it's going to be enough to make up the difference, just depending on your specific age, gender, and tobacco use.
Great. The next one I have is, can you explain the difference between the Medicare deductible and the Medicare out-of-pocket maximum?
I'm just writing that down. Out-of-pocket maximum, did I hear?
Yes.
Okay, so the Part A has a deductible of $1,484 when you go into the hospital. So as soon as you go in the hospital, that's the first thing you pay, okay? The Part B deductible is the $203 that you pay. You have to pay that, right? That's not a huge amount, but each spouse pays it. right? If you're both at 65. And I think the second part you were asking me was about the cost sharing part. Did I miss that part? The deductible I said, and then what was the second?
Medicare out-of-pocket maximum.
Yeah, okay. So the Medicare out-of-pocket maximum applies when there's a Medicare Advantage plan. That was that $75.50 I was saying to you. That is the big selling point about Medicare Advantage plans. Beyond $75.50, the insurance company is now on the hook. So that's that out-of-pocket maximum when you're talking about a Medicare Advantage plan. There is one, as you saw on Part D drug program, but let's not even go there because you saw there's some co-insurance and catastrophic money that you have to pay. So that's not the same thing.
Okay, great. This one's a long one.
Okay.
So it says, I heard something about Medicare changing when you move to another state, or is that Medigap? We are thinking of retiring somewhere else, and I'm concerned.
Good question. Okay, so Medicare travels anywhere. It doesn't matter if you move out of state, okay? When you move out of state, you typically would change your Medicare Advantage plan and your Part D drug program if you had them separately, let's say. So people move and they have a Medicare Advantage plan, they'll get a window where they can get into a new one when they move to their new state. Obviously, the prices and the benefits could change. In the case of a Medigap plan, Medigap travels with you. So if you have a Medigap plan here locally, okay, and you move down to Florida or another state, that plan goes with you. So you really, the only thing you need to do in that case is change your Part D drug program because that's a standalone plan. Good questions.
All right, I have one more here. And if anybody else has any more questions, go ahead and drop them in and we'll see if we can get to all of them before we hit our time here. This one is about dental and vision. Yeah. Some Medicare Advantage programs cover dental and vision, right?
Correct.
Or should I get a Medigap plan for that?
No, well, Medigap doesn't cover routine dental and vision either. So keep in mind, what most people do is if they have Medigap and a Part D drug program, they'll go in and buy a separate routine vision and dental plan. I was reading somewhere, it's usually about $36 a month, depending on where you are. That you can get through a Medicare broker as well. So if a Medicare broker sells you either a Medigap plan or a Medical Advantage plan, they probably can get you an inexpensive dental or vision or hearing type of plan.
Okay, we just got one last one here that just popped in. Can you go over the HMO and PPO for Medicare Advantage again really quickly?
Sure. Let me take you to that slide if I can get there. So here it is. So HMO, a lot of people like it because it's cheaper, right? But you have to get a primary care physician, you need referrals, you can't go out of the network except for emergencies, and you heard my emergencies there. Of course, every insurance company, who knows what that emergency is. It could be $10,000, you know, in the case of foreign travel, as an example with a Medicare Advantage plan. There's no health questions to get in from that standpoint, but you know, you have prior authorizations. A lot of people are familiar with this, you know, when they go to the doctor now pre-65. The PPO just allows you a lot more options as far as doctors are needing to go out of the network. So if you're traveling, you might be able to go to a doctor. It's just going to cost you a lot more if you go down in Florida versus going down here in Bethesda. And then a lot of them have this gym membership and routine dental, so a lot of people like that. But the big thing is you'll pay more in premiums for a PPO versus an HMO. And if you move, like I said, you can get into another plan, and that's typically how it works.
All right, well, great. We are out of time. And if anybody has any additional questions, please feel free to email us. We'll send out the guide that Danny mentioned, as well as a link to the replay of this video, should anybody decide they want to kind of go back and look over some of the things that we talked about. And thank you so much, Danny, for joining us. As always, you're a wealth of information. I appreciate it. I think my head's ready to spin off my head between Social Security and Medicare. It does get complicated. Yes, it does. Sure. It does. You got to do it almost every day to remember it. It's definitely very, very true. Anyway, thank you everybody for the time. Appreciate you being attentive. And Kim and Kara, thank you so much. Appreciate it. All right. Thanks everybody. Have a good day. Bye-bye.